All right, so for today, I'm going to be doing my upper extremity presentation. My upper extremity was on a rotator cuff injury. And in today's presentation, the contents you'll be seeing are the anatomy, etiology, group affected, treatments, post-treatment, prevention, and my references. So the anatomy of the rotator cuff is actually located in the shoulder. It is made up of muscles and tendons that keep the ball of the humerus in your shoulder socket. These muscles include the supraspinatus, infraspinatus, teres minor, and subscapularis muscles, also known as SITS. So the supraspinatus muscle elevates the shoulder. The infraspinatus externally rotates the shoulder joint. The teres minor does the same as the infraspinatus, so it'll externally rotate the shoulder joint. And the subscapularis allows humerus to move freely during elevation of the arm. So the type of injury that you can get in the rotator cuff are strained ligaments. So when it's injured, it's considered a strained ligament. There are a total of 3 grades. The grade 1 and grade 2 strains include partial or full thickness strains in the fibers of the muscles or tendons. The grade 3 strains includes completely strained muscles or tendons. So as you can see here in the picture, we can see what a partial thickness tear, full thickness tear, and a completely torn rotator cuff would look like. Any of the muscles that I listed previously can be injured, and that can be considered as a rotator cuff strain. So the etiology, rotator cuff strains are caused by repetitive overhead motions or heavy lifting. For example, a baseball player may suffer from a strained rotator cuff since the sport requires a lot of overhead throwing. On top of overhead throwing, you would see a lot of high velocity in the arm movement, so that can play a factor as well in tearing the rotator cuff. Other examples include heavy weightlifting. Other sports such as tennis, swimming, basketball, golf can also cause injury. Also, besides sports, construction and age can play a factor in your injury. So I have a quick video here just showing Cubs player getting tearing or injuring his shoulder. So I'll just play it really quickly, and I'll just skip to where it happens. Oh. So here is a replay of that. Releases a ball, instantly feels it. Yeah. So groups affected. The main people actually affected are elderly people. So like I said before, age does play a factor. Through wear and tear, you can injure your rotator cuff or get tears. On top of that, sports that get affected the most are sports with overhead movements, like I said before, weightlifters, construction workers, and can even be due to personal or family history. Some treatments. So depending on how severe the injury is, rotator cuff strains can be treated surgically or non-surgically. Conservative treatments such as resting, icing, and physical therapy can help treat rotator cuff strains. Another form of conservative treatments can be or taking like painkillers, medicine orally, or even if the injury is affecting your sleep, daily living, or physical therapy, actions such as injections or even surgery may be even required. And then here's just a quick video again on some rehab for torn rotator cuffs. So I'll just skip to them here. So we'll go. Okay, so that's one. And here's another one. Here's another one. So basically all we're doing here is just reteaching the muscles how to move again after surgery. He's basically just reteaching the muscles how they're supposed to function again. And then here's the last one. So for non-surgical treatment, non-surgical treatments for rotator cuff injury is for grade 1 and grade 2 strains. Either partial thickness can be an example of grade 1 and full thickness tears are an example of grade 2. And then again, conservative treatments such as rest, icing, and physical therapy, or even taking in medicine orally can be non-surgical treatment. Usually it will take longer for your shoulder to heal due to non-surgical treatment. But regardless, if that's the route that you want to take, it's still a possibility. Next is the surgical treatment. So grade 3 strains, it's fully torn, you need to get surgery. So grade 3 strains do require you to get surgery, completely strained fibers of muscles or tendons, and may not need to get total surgery, but you can also get steroid injections, but you should probably get surgery. Here are just some exercises on rotator cuff injuries. So we see a lot of isometric exercises, as well as using the wand for flexion and extension. And then you would want to abduct and adduct your shoulder as well. Basically, again, reteaching the movements in your arm or in your shoulder. And yeah. So post-treatment. So despite all the troubles caused to treating the injury, after surgery, the shoulder functions will improve. So that's a great thing. However, recreational athletes, they can return to the same level of sport. However, only half the competitive athletes return to the same level. So it really can be a career-ending injury if you're a professional athlete. Some ways to prevent injury. Overhead activities are one of the main causes of a rotator cuff strain. If possible, to avoid those movements. Stretching and strengthening the muscles around the rotator cuff is also a great way to prevent it. And even the way you sleep, so avoiding sleeping on the sides and lifting the arm overhead can be a good way to prevent injury on your rotator cuff. Hot and cold compresses help with reducing inflammation. So after a workout or an exercise, applying hot and cold compresses can help with reducing inflammation. And my references. That's it. Thank you very much.